Spinal cord stimulation is a method of treating chronic pain, particularly in the back and legs, although it can also treat pain in the arms. Typically for patients who have had surgery and it has failed, or more accurately, it hasn't failed necessarily, but they still have pain. It can be used prior to surgery if they are not a candidate for surgery or choose not to have surgery. It uses a small electrical current to stimulate the spinal cord, and in doing so that creates a sensation in the body called a paresthesia, which is a pleasant, unusual sensation, sort of a warm, fuzzy, buzzy, tingling sensation that replaces the painful sensation, which is called a dysesthesia, or a painful abnormal sensation or unusual sensation. And that blocks the body's ability to pass the painful sensation up the spinal cord into the brain. So instead of feeling the pain, you feel that sensation. The nice thing about it is that it can oftentimes replace the need for a lot of medications, narcotic pain medications, reducing the risk for adverse events, side effects, etc. from the medications. But most importantly, we see that it returns patients more to an active, normal life. Our goal is to get the patients up and about and moving and returning as much to the life they had before chronic pain developed as possible. And we've had great success with that. One of the nice things about spinal cord stimulation is that, unlike, say, surgery, for example, where you go in and you see the surgeon and he describes the procedure and gives you the risk and gives you the potential benefits, and everyone, including the surgeon and the patient, hopes that it all turns out that way. But if it doesn't, you can't undo the surgery and give the surgery back. With spinal cord stimulation, the leads or wires are placed in the epidural space, superficial or dorsal to the spinal cord. And we can place those through the skin, through needles. The needles are, of course, removed. The leads are left in place, and the patient gets to go and try it for a week before deciding whether to have permanent implantation. So you get to test drive the device and the treatment. And then if it's successful, the patient can choose to have implantation if they're deemed appropriate for that. If there's a successful trial, an implantation is a minor procedure, day surgery. A small incision is made to insert the leads and to put the generator in place. The generator is the same technology as cardiac pacemakers. In fact, the company that originally developed spinal cord stimulation is Medtronic, and everyone's familiar with them and their pacemakers. It's the same technology, only instead of stimulating the heart, thump, 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 it stimulates the spinal cord. Bzzz. So the generator is very much like a pacemaker, only slightly larger than a pacemaker, in fact as small as some pacemakers. They're rechargeable, so that if you run the battery down, you can recharge it right through the skin. They last about 9 years, the rechargeable ones do. And the most recent development and advancement in spinal cord stimulation is again by Medtronic, the premier company that manufactures them, and that is a device called the sensor generator, which has an accelerometer built into it. The amount of technology that is in these devices is incredible, although I guess that's not so astounding considering what's happened with cell phones over the past 10 years. But it senses your body position. One of the problems that you see with spinal cord stimulation, or can see, is that with changes in position, seated versus standing, lying down, there can be changes in stimulation strength, and so the patient has to constantly adjust the stimulation so that it's still comfortable and yet still gives them a good relief of their pain. This device learns their position changes and how they have adjusted the device, and automatically adjusts it to that level when they make those position changes. It's a much more efficient use of the energy, the power. It lengthens the recharge interval, it extends the battery life, and takes a lot of the, in those few patients that are having a lot of difficulty with that, it takes that away completely. It's automatically adjusted for them. So we're real excited about that, and have implanted a few of those already, and patients just love them.